When it comes to supplements, it is a chaotic world out there.
You've said before that healthcare needs a paradigm shift. What do you mean by that?
The best time is day 19 through 22 if you're testing for hormones. I'd say gut testing is a big one, from microbiome testing to inflammation testing within the gut.
Doctor's Best is a company that has tons of incredible high-end supplements. When talking about just overall improving your gut health, what are some of your favorite supplements for skin health? What about anti-aging? That's a hot take a little bit.
Chronic disease is so problematic today that, just like you're saying, do we want to live 40 years longer but feel like crap the whole time?
What are your thoughts on melatonin?
I want to go deeper into the gut.
Yes, it is expensive to take care of your health, but we always say it's more expensive to take care of your sickness.
There's probably a lot more people than are willing to admit or don't even know that they're not living to their fullest these days.
Welcome back to another episode of Gut Talk, or if you're new here, hi, welcome. My name is Jenna, and I host this podcast with my older sister Jill, where we talk about all things health and wellness. Today's episode is one we are really excited about because we are sitting down with Dr. Devin Stone, a naturopathic doctor and a brand ambassador for Doctor's Best. This conversation is basically what happens when you get a naturopathic doctor in the hot seat and ask everything you've been wondering about your health, but didn't know who to ask. We pulled real questions from our audience, and nothing is off limits, from gut health and hormones to labs, supplements, and what actually matters versus what's just hype. And before we get into it, we want to quickly talk about supplements because, let's be honest, they can feel really overwhelming. There's so much out there and it's hard to know what's actually worth it. That's why we love Doctor's Best. They focus on science-backed, high-quality ingredients without all the unnecessary fluff, and it's a brand we trust when it comes to filling in the gaps, whether that's gut support, sleep, recovery, or overall wellness. We'll actually be breaking down specific supplement recommendations with Dr. Stone throughout this episode, so you can walk away knowing what's worth your time and what's not. In this episode, we talk about why healthcare might actually be more sick care, what a real preventative approach looks like for women in their 20s, 30s, and on, how often you should actually be getting labs done, and whether you should be seeing a practitioner before something even goes wrong. We also get into the gut, of course, from where to start if you're dealing with chronic symptoms, to the gut-brain connection, nervous system regulation, and all the symptoms that a lot of people struggle with but don't fully understand. Plus, we walk through a simple, practical framework for healing, including reducing inflammation, repairing the gut lining, and rebalancing the microbiome. And we get Dr. Stone's honest take on trending therapies. Please note that this is not medical advice, and ensure that you consult your health provider before starting any supplement, and always check for interactions with other medications. Supplements mentioned will be linked in the show notes, and you can use our code GUTTALK20 for 20% off. Now let's get into it. Please welcome Dr. Devin Stone on Gut Talk.
Dr. Devin Stone, welcome to Gut Talk.
Thank you. Yeah, excited to be here today.
We're so
excited
happy to have you.
Straight off the plane. Jenna was saying before we started recording that we get questions all the time of just like, what do I do in this instance? What do I do here? You have your own practice based out of San Diego.
Yep. So
you're seeing patients every single day, right?
Exactly.
So I'm sure you see probably a lot of the same themes over and over again.
Definitely. Especially being a naturopathic doctor, it seems to bring a certain type of patient base over time as well, especially people looking for answers that they just have not received over and over again. That oftentimes comes into our office, but yeah, there's definitely themes when it comes to hormones or gut health or how to eat different types of foods that people aren't working with. I'd say prevention is also a huge area we like to focus in, but yeah, definitely see quite a few themes over time there.
Explain what the education is for a naturopathic doctor, because I feel like there's so many different sectors of the holistic-y health world. What does naturopathic education look like?
It's a good question because, I mean, even before I went to school, I applied to naturopathic medical school like 3 months before I went because I didn't even know it existed, this type of degree and license. Because there's a huge, I would say, divide between being a naturopath and a licensed naturopathic doctor. anyone out there could call themselves a naturopath. You don't need formal education. You don't need licensure. So it sometimes takes away a little credit from, I would say, our degree. In terms of our degree, it is pretty on par with a MD-DO degree for the most part. We go to 4 years of undergrad, 4 to 5 years, depending on what track you go of medical school then. I'd say the first 2 years are pretty much identical to MD-DO school, where we're doing our basic sciences. So your physiology, anatomy, biochemistry, those types of classes. And similar to like MD school, we take our first set of board exams after the second year. And then we go into our clinical years. And I'd say that's where there's a little bit of variation, where we still go through our pharmacology and some of the clinical applications, but we then go a lot more into some of the alternative natural therapies as well, where they might start specializing more into surgical interventions and some of their methodologies that are needed and used. But that's where we kind of separate a little. Then after that 4-year period, we take our last set of boards and could apply for licensure to practice medicine similar to MD or DO then.
So can you prescribe medication?
Yes.
Okay. Yeah. So it really is just like more so, it sounds like the end of your formal education, where they kind of shift away from what a traditional MD would focus on.
Exactly.
Okay.
Yeah. I'd say in like a primary care MD, our license is very similar in terms of what we can do legally per se. We have the right to diagnose, we have the right to treat, we have the right to prescribe, we have a right to do minor procedures and whatnot. However, I would say our scope and our toolbox of how we practice is very, very different. Where yes, we can use pharmacology, which is probably the main intervention on the other side, which we believe in because there is a time and place and setting for drugs as well. But we look at many other different methodologies, such as lifestyle changes, herbs and nutrients, if we could use them. We also take into factor the kind of whole body medicine as well, mind, body, soul treating as well, that we need to look into. So I'd just say our toolbox definitely gets a little more broad per se, which is very fun because we kind of choose what is best to fit the patient to really get them to what I think true healing.
Yeah.
You've said before that healthcare needs a paradigm shift. What do you mean by that?
I started a kind of phrase on my Instagram promoting healthcare, not sick care, quite a few years ago. And it's been really awesome to see how much the world has been changing over the last 4 or 5 years in terms of health and wellness and what people are getting new knowledge from and seeking these days. But basically what I was kind of alluding to was we obviously built this healthcare system, which is one of the best in the world, don't get me wrong, but we definitely missed a lot of the essence of wellness as well, where it really deviated towards just the prescription and surgery type of outcomes for patients. And we kind of lost some of the basics of health and wellness when it comes to at least how a doctor should be working with someone, where yes, if you're sick, you go in, you get a medication that can maybe alleviate some of your symptoms, but they're never diving deep into helping someone with the foundations of health, really looking at all their lifestyle factors like sleep, gut support, in your guys' case, your nutrition, your hydration, all of these other factors to really build a comprehensive plan for someone. So that is what I mean kind of by a paradigm shift, really going back to the true wellness and bringing that back to someone where we could help truly heal them and bring them back to who they should be in this life. So.
Yeah. I'm with you with like things are feeling like they are changing, probably because of social media is my guess, because I feel like 5-6 years ago, like when we first started our health journey, what we were doing was so odd to most people, right? And what we were doing was like muscle testing, taking supplements, like changing our diet, and everyone was like, Jill and Jenna are going woo-woo, right? Totally. But now like that's what not everyone, but that's what so many people are doing and striving to do, is changing these factors. And I do think it's because of voices like yours and social media, people speaking up and saying, listen, like things might not be working because you're not down potentially the right path.
I still get pushback from some of my friends. They'll tell me about these issues, and in my head I'm like, you shouldn't have this, like you can prevent this. This is not something that you should be dealing with, but that conventional medicine often just says is like something you're stuck with. And a lot of things that have to do with either like hormonal issues or gut issues. I mean, we started this whole thing because we both were sick as kids and into our young adult lives. And I had IBS, and let's see, 10 years ago, maybe longer than that, I was told I was going to have IBS the rest of my life. And I was like, I cannot fathom having this the rest of my life. And of course, once we found someone who was more off the beaten path of just regular, normal, quote unquote, medicine, all of a sudden, all my symptoms went away. And it was like, oh, okay. I don't care if you call me woo woo. I don't care if you think I'm crazy. I watched it happen drastically in my own body. And therefore, like, your opinion does not bother me. But it's hard to see my friends out there who are like, well, that person doesn't take insurance. I'm not going to see them. Or like, they're really expensive. It's like, yeah, but so is your medication when you pay for it every month for the rest of your life. It's like, we almost have this like wrong mindset of where we're willing to spend money. Like, you'll drop $150 at the bar, but you won't pay for a $250 consult. Like, to me, it just feels like there's this unfair opinion on doctors that are just not conventional because of either price or methodology, or you hear someone who's like kind of annoyed that you're like, oh, we can heal you in that. Do you ever get pushback from either patients that you see or maybe people who are like inquiring about your practice regarding just like your way of thinking and working?
I'd say it's definitely gotten more accepted nowadays. I feel like I'd say our practice, we did make kind of a cool model where we made it like a membership model at a lower price, where our kind of idea was we wanted it something where patients or our clients or patients that are coming to us, it's something that they could expect a certain monthly fee that they know isn't this really large price tag. Because I see that a lot with colleagues around me where one visit could be so high in cost where just getting in the door the first time, or let alone you're going to need a follow-up with the way we practice. Like, we don't get things done in one session. Like, it's not going to happen. Things change. We need to adapt. We need to see, retest, whatever it may be. So we try to make it a lower barrier to entry and also just have the ability to work longer with patients. So I'd say the model we created was very helpful with that and allowing it to have more access to more people. I got to say, though, it's still a luxury in some ways too. Unfortunately, that is one world that we'd love to penetrate, is being able to give this type of medicine to more people. But definitely we're trying to find the best sweet spot to make sure we actually have a practice and can keep the doors open and see people and get it to the most people possible.
Yeah. With the people that you do see, how do you recommend going about proactive medicine, proactive health?
Yeah, which is, to me, one of my favorite areas to actually work in is someone that'd be kind of quote unquote healthy, or just wanting to prevent disease or look at putting together this longevity plan. How could I stop disease in the future as well? As naturopaths, we have like 6 pillars to the way we're trained, and prevention is actually one of the major focus areas we look into, because we're big believers to like work with your doctor to also prevent disease. Don't just wait till you're sick to come see us, because there's so much we could do at all times. And just like what you were talking about a moment ago, there's so much information on social media now too, which I find that really rewarding, but it also could be super overwhelming for the end user as well. Do I do cold plunges? Do I take this supplement? I mean, the list goes on and on and on.
It's a full-time job.
It is, and could cost thousands and thousands of dollars if you did everything that people are promoting nowadays. So I'd say that's always something I sit down with my patients, like, let's take your full history. Let's understand what your concerns are. Let's understand what maybe we see on blood markers or lab testing that could be causing a disease down the road. And we'll pick the 5 best things for you at this specific time. Because, and I tell them that, like, there's a million things I could tell you to do, but we're not going to do all of those. Let's stick with the first 5 that we could really get the needle moving, and then we'll adapt. And that's where it comes into those follow-up appointments, because health is a journey. It's adapting at all times. That what we start with day 1, we're going to change down the road as well, and hopefully get them to better health, or also help prevent things that we see could be in their future potentially.
What labs do you recommend women specifically getting on maybe an annual basis?
For sure. Yeah. Lab work is something we love in our world, data, because one, we could see what we need to change, as well as there's a lot of really amazing labs out these days now as well.
When you say amazing, like just the data that they provide?
And just what you could test for these days. Most people, like they'll come into our office and say, oh, I already had my annual physical, everything looked good. But if you understood what was on those labs, they're so basic at certain times where it's like, okay, yeah, your liver's not failing, your kidney's not failing. But someone like you two, like there's a lot of other stuff that you would want to look into. So really in-depth hormonal labs, that is one area. And especially for females, like I see this all the time, even if they had some standard hormones ran, that they just ran them on a random day when they're in that doctor's office, which is not appropriate. Females obviously are having a cycle throughout the month. The best time is day 19 through 22 if you're testing for hormones, when estrogen and progesterone are at the high in your luteal phase. If you're not capturing that window of that exact time doing your blood test for hormones, you're not really getting a good reading. And then we even have more in-depth blood testing, or actually through urine testing, called the Dutch test, which I'm a huge fan of if there's more to the hormonal picture that we think is off as well, where we could actually test the hormones through the entirety of a full month, where we do a test every 2 days for a full 30-day cycle and understand how progesterone, estrogen are changing throughout that whole cycle, where we could really kind of tune in a little bit further to see what's off. That's hormones. Then I'd say gut testing is a big one, from microbiome testing to inflammation testing within the gut. Food sensitivities, I'm not as big of a fan of. The data is a little bit up in there how well they work.
Everyone's sensitive to eggs.
Everyone is. And I've noticed, like, if patient has a lot of a specific food in their diet, or they ate it the day before, or if they have leaky gut, almost everything starts getting triggered, but just because it's passing through and their immune system's being evoked.
That's a hot take a little bit.
Yeah.
I feel like, I don't know, I feel like food sensitivity tests were very in the at-home ones.
Totally.
But what you're saying is there a place for them though, or you don't use them at all?
I'd say when I first started practicing, I did, but I don't really ever, unless a patient's really adamant for asking for it. I'm like, okay, if you want to know, we could look into it. But I'd say usually people go towards that because they know something's wrong with their gut and they're reacting to foods. They're going out and stuff's happening. Where when we understand like what some of those foods are, they're not having a true allergy, so it's not like a food they can't ever eat. And usually the protocol is to reduce inflammation and repair the gut anyways. So instead of having them pay a $200 to $400 test, I just get them right into treatment. I'd rather just start treating the gut anyways, and we get the same outcome with usually less expense.
Yeah, that's music to our ears. We're always trying to figure out, like, yes, it is expensive to take care of your health, but we always say it's more expensive to take care of your sickness. Like, you're at some point you're going to pay for your health, and I personally would rather pay up front when I have control instead of reacting to whatever happens down the line, because we've both been there where we've had to go through tons of testing and treatment plans, and it does get pricey regardless of who you work with or what type of doctor. So I feel like preventative is always the way to go if we can.
And our main group of people that listen to this podcast, like our community, is about like 18 to 45-year-old women, right? I don't know that many women these days that feel 100% good all the time. Which, because as I'm sure you see, is that the modern day that we're living in is very stressful to our bodies. We can say preventative measures, but I feel like a lot of it is like, you know, your hormones don't feel good, or your period sucks, or maybe you have some gut issues, which we're going to get into more of like gut healing today. But you probably see it that people also maybe aren't as healthy as they realize. We normalize really painful periods. We normalize having gas and like having stomach aches all the time. But in reality, I'm sure coming from you, you would say that maybe that's not the case, right?
Yeah, I think that's funny, not funny, but it's alarming just how normalized it is, because like even Doctors Best last year, or they did a study over 2,000 people, 1,000 men, 1,000 women, where they just did a health survey, and they showed about 51% of the people surveyed had some type of chronic condition going on for over 6 months. When it came to gut issues, it was about 30%. In millennials, it was about 50% of millennials having gut issues. But then that takes it into even further, where you're stating people that don't even realize at times that they have. I think those numbers could even be higher, because so many people do normalize all of these conditions because most people they talk to might have some of these same conditions, or they've just been living with this their whole life without answers that they got so used to whatever condition there is. And I see this all the time where it's like, okay, we see it on lab testing. I could kind of see the light bulb going off because of what they're telling me, but they might not even see it. But then we start a treatment plan, and 3 months down the road, they're feeling better, like, oh, you're right. Like, I feel better. I didn't even realize like I could feel better from what was happening to this state. So there's probably a lot more people than are willing to admit or don't even know that they're not living to their fullest these days, just due to the environment, how things have been going to date with their health.
I feel like there's this common phrase of, I'm just getting older. And it makes me so angry because not just physically, it's like your back doesn't hurt because you're older. Your back hurts because you stopped working out 6 years ago and like you're not in as good of shape as you were when you were younger. It's not you literally getting old. What are your thoughts on aging and our ability to stay healthy if we maintain the like upkeep? Like, do you feel like we can still feel really good in our 50s, 60s, 70s, 80s? Or is there something to be said for just I'm getting older?
No, I mean, I'm a huge fan of especially the longevity world these days. There's so much coming out. There's so much that we're learning and understand about the human body today that I think nowadays medicine is looking at. We used to look at lifespan, like how long can we make someone live? But now we're also looking at health span even more too, like not just keeping someone alive for longer, because we've gotten very, very good at that. But chronic disease is so problematic today that, just like you're saying, do we want to live 40 years longer but feel like crap the whole time? Most likely not. So we're trying to fill that gap now of getting the health span further, where you're living good years for longer periods of time. And to me, it's kind of funny. The basics are probably the best thing possible to get there: your food, your water, how much you're sleeping. But from there, there's a lot of amazing new technologies and interventions that are going to aid with that as well there.
We don't need to go too into the weeds, but what are some of your favorite longevity treatments or hacks?
Definitely. Like I said, the basics for sure to begin with. As a naturopathic doctor, we're trained with what we call your determinants of health, where it's your food, it's your exercise, it's your sleep, that if you're not addressing those, don't even treat a patient with anything else yet. So making sure you have those in alignment with yourself and with your end health goals. But I also want to put the caveat, you don't need to be too kind of type A on those things as well. Like, you got to live your life. It's a big factor to your own goal of health too. But outside of that, I guess interventions, I mean, there's some really hot topics these days, like a treatment that I do called EBU therapy. It's become very popular. It's been in Europe for a few decades, but in the US, it's been kind of getting a little bit more traction here, where it's a process where we take an IV. It basically is filtering and ozonating your blood. It's like, we call it the oil change for your body, where we're basically kind of cleaning out your blood, restoring it, making it hyperoxygenated so it could heal the rest of the body better. The ozone and UV light that it goes through kills pathogens, so parasites, bacteria, viruses that are in there. It's kind of a cool revamp. I'm seeing amazing results with patients for that.
Like of what topics? Like, what are they healing from?
Honestly, it's been amazing. Like the variety of patients, patients with high cholesterol I've treated, doing supportive treatments for patients going through oncological care, cancer care, done different viruses and bacteria infections with patients.
Very cool.
Yeah, and just people that are healthy but also want to prevent disease down the road too, because our blood is such a major element in our body. To help restore that has been, I guess, a really big and cool treatment to be working with right now.
Yeah. Any others that you are utilizing for either longevity or preventative care?
Definitely like any type of oral NMN, like Doctor's Best makes a really good one with CoQ10. It's one of my favorites in terms of the supplement world.
We have 3 grandparents still alive. Our grandmother passed away of Alzheimer's in 2019. We have 1 grandma and 1 grandpa with dementia right now. So we are very
pro brain health,
where like our parents are taking major steps. They've done scans, they've done all the blood work, yearly blood work. Our family's very much into preventative health because, knock on wood, we have pretty good genes, right? Both of our grandpas are 96, our grandma's 92. But seeing the way that you can exist for the last 10 years of your life if you don't take care of your brain and you don't take care of your health, it's very sad, right? Like compared to our grandpa who is completely cognitively and physically there, and he lives just such a better quality of life. And so our podcast knows about this because we've talked about it. We've had different people on, but it is very important for us to just pay attention to brain health. Is there anything else while we're on the topic that you love for more of the cognitive function?
Definitely. I'd say fish oils, just decreasing that inflammation to the brain through like omega fish oils. Doctor's Best makes a great fish oil as well as a vegan version as well that comes from algae, which is very beneficial. But that's one that I use fish oil for many different reasons, but definitely for brain health, just getting rid of inflammation, keeping up with your antioxidants. So even just eating berries daily, that's a big aspect. And then there's this whole world of peptides nowadays too. There's some really cool peptides for brain health as well that we work with in our practice help with, post TBI, traumatic brain injuries, or for memory decline. And then some other supplements as well, like ginkgo biloba is one I use quite frequently. Really great for memory and recall as well. But yeah, just kind of, I'd say one depends on the patient, what's going on, what they're looking for, but there's some really good alternatives out there.
So even we're in our early 30s, late 20s, is it important for us to start now, or can we wait to start working on our, not mental health, but our cognitive health until we're maybe in our 40s or 50s?
I would say now is always good. The sooner the better of starting to just support our brain and making sure down the road, this goes into the prevention side of things. It's one of those things, easier to work on it now than reverse it down the road for sure, is something big to do. Something else that, once again, going back to testing, that's really fun. There's some really good like neurotransmitter testing out there as well, where you could test all of the different excitatory and inhibitory neurotransmitters like serotonin, dopamine, GABA, what they break down to understand even the chemistry that's within our brains, to see if there's any type of deficiencies or efficiencies, and start working on that earlier on too.
We've mentioned Doctor's Best a few times, and just for our listeners, can you explain? So Doctor's Best is a company that has tons of incredible high-end supplements. I don't think anyone knows how you're related to them, so just give your background and how you're related to Doctor's Best.
For sure, yeah. So I've been working with Doctor's Best as a brand ambassador. Basically, I've been helping them from a doctor's standpoint, just give education out there behind their products, helping people understand that there could be some other solutions to help support their health goals there. When it came to that, I've been very picky of working with brands over the years. I never wanted to be that type of person. It's like, okay, here's my promo code and it's on my social platforms, because that's not in alignment of where I'm going. But they reached out to me, and seeing the quality of their products was the biggest thing there. When it comes to supplements, it is a chaotic world out there. A lot could fly. That is very scary these days. With them, the awesome part was they use a lot of what are called branded ingredients. If you see any of their products, they have a registered trademark next to a certain name. Those ingredients actually have gone through true clinical trials. So we know there's actually data to support what you're putting into your body for an outcome, if it looks like something that might fit your what you're trying to achieve there, or your doctor helps prescribe for you. So you're getting good quality. It's backed by science, which is awesome. And that really led me to, yes, I would like to kind of help work with you guys and get some of your products and make people understand that there are some other options that could be just done through supplementation there.
It is so hard not to go and buy the supplement that your favorite influencer, your favorite celebrity either started or is backing or is being paid 7 figures to promote, just because it's fun, right? Like the packaging sometimes can be cute, and it just is like, it almost romanticizes taking care of your health a bit. But what you mentioned is so important, having the science-backed research and having the actual high quality of supplements, because like you said, it's the wild, wild west out there. And if you're going to spend money to take care of your body and improve your health, it has to be with high quality ingredients that have science-backed research to them. If not, you just don't know what you're putting in your body. And ultimately it's like, if you want to spend your money, like do it with a little bit of purpose, right? So
Definitely.
I want to go deeper into the gut. I want to talk a little bit more about gut healing. When we put a question box up on Instagram and we're like, let us know what you would ask if you got the chance to talk to a naturopathic doctor. So really what our community and us are trying to understand is like when someone walks into your office and they're complaining of GI issues, right? Whether it's they have anxiety, their gut-brain axis is out of whack, maybe they don't even know it is, or they're bloated, they have skin issues, their bowel movements are not good, let's just say. What are the first things that you tell them when they walk into your office, when someone walks into your office?
For most patients, we still go through a pretty in-depth formal intake. We spend about an hour the very first appointment. So,
love that.
With that said, because the body, just even all the conditions you mentioned, skin, gut, brain, I mean, all of these are so connected actually, that if we just work them up for their gut alone and don't really do a full holistic interview at the beginning there could be some really crucial information that was left out. Like I see this all the time and could even talk about a couple of cases where that's come up, but it's taking the time to really fully understand who they are and everything, at least in terms of health, that could be leading to at least their gut issue as of today. Once we get that information, then it's we kind of go through what we call, if it's a gut issue, in terms of just the gut alone, we go through what's called the 3 R's. What starts with remove if there's any unwanted pathogens or triggers. We got to remove those from the environment. Then repairing the actual gastrointestinal system, and then re-inoculating it, giving back the right microbiome to the area. But with that said, that's just the gut, but we need to look at the holistic aspect as well, because oftentimes there could be a mental emotional aspect that's alongside of that, or another system within the body that's off that we need to help as well.
Let's talk through it. You go through the whole, like, understanding who the person is, questions that you guys ask. I'm sure you have like you said, a huge survey that they fill out. Do you start with testing? Do you lead with testing, or is testing optional?
Definitely optional.
Okay.
Just because, I mean, especially when it comes to gut testing, it can get pretty pricey at times. Like a full microbiome test where you're seeing all the good bacteria, bad bacteria, parasites. I mean, it could run $300 to $800 at times there. So, however, it is very, very valuable information at times because I would typically tell a patient, if it is looking like we're having dysbiosis or something wrong with the microbiome within the gut, that it'd be really worthwhile to go down this path, because we're going to find answers that you potentially may have never seen before there. So that usually is my first step, but sometimes it is not just dysbiosis. It could be also looking into if there's triggers that are causing it. It could be mental, emotional triggers. It could be food triggers. Looking at those as well, so we could understand what we need to get out of the GI tract to begin with. So that's the first R, the remove aspect. Cool. So that's through testing as well as just getting their history done. The next step then we go into, after we know what we need to start getting rid of, if it's bad bacteria, or sometimes it's even good bacteria that are overpopulating, or food triggers, then we start looking at repairing the gut itself. So this is where I like to, once again, use fish oil is one of my favorites there, to just get rid of inflammation within the gut. Oftentimes there's been so much happening within the gut at this time that it's very inflamed, that we want to kind of start calming things down. So use fish oil. And then the next area that we look at is stopping what's called quote unquote the leaky gut or intestinal permeability today, which is, with all of that inflammation that was happening over time, our gut is supposed to be a barrier, only allowing things that we want in and keeping out the stuff that we don't want actually entering our body. Over time, the junctions of the cells that should be really tight in a wall start breaking apart, and that's leaky gut. So we need to start repairing that. And I usually, one of my favorites is L-Glutamine for that. We could also use like peptides like here, that are some of the building blocks to help repair some of these endothelial tissues. And there's also a really good product that's called PepZin, which is actually in Japan a medication that's actually used here. It's actually just a supplement. It's not a prescribed medication that helps also repair the gut barrier itself there. So that's the second R, the repair part. Then the last is the reinoculation phase. So now that we kind of got the bad guys out or not adding triggers there and we repaired it, we want to start rebuilding it back to the microbiome that we should have within there. And this is where, to me, testing is so important, because probiotics are all the rave out there. Like take your kombucha, take this probiotic, but even probiotics could be really detrimental to your health if you are taking too much of a certain strain there. Especially we see this a lot with people that drink a lot of kombucha over time, because it's typically one probiotic that's making that, and it's good, but our gut is real estate, and there's only a certain amount of area that these bacteria could take over, and we could actually start putting too much of a good one in that area that some of the other good guys that we need for other functions don't have place. So this is where testing is really important, because we could see which good bacteria we actually need to repopulate, and then put together a probiotic plan that's specific to the patient themselves. So it's, let's take these strains here and start rebuilding it based on what your body actually needs.
Yeah. Our last guest that we had on was a little anti-probiotic, and the conversation was more about fiber. But what do you think, if probiotics get a little overhyped, what do you think is underhyped for the gut? Like, what type of supplements would you say?
And one that we use, similar to fiber, Doctor's Best also has something called Postbiotic Butyrate. It's similar to fiber. It's also food for the bacteria that's within our gut. So once we kind of got rid of all the bad invaders, you could go two ways of it: start rebuilding back with probiotics themselves, or also give food per se to help start regrowing the good beneficial bacteria that are within our gut there. And that can be done through fiber or short chain fatty acids like butyrate.
With the butyrate, if you have bad gut bacteria, is it going to feed the bad as well, or is it just feeding the good?
So there is a possibility. So that's once again where testing is so important, because some of these, if we're just starting to give food per se to everything, yes, there could be rebuilding there. So that's why we always start with that first phase. Once again, we want to remove anything that's bad, so it gives the opportunity for the good guys to really start coming back.
I love the fact that you kind of went through the steps, because the theme, I think, of this episode is like not blindly following advice, right, that you see on social media, like really actually taking the time to go through the steps, because sometimes people lead with probiotics, right? But what you're saying is that there's really this time where you like need to use this R method, because there's a delicate balance that is required to really heal the gut, especially if you've dealt with chronic gut issues for years, right? So like you're saying, if you just go in and you just throw some probiotics at your gut, either it's going to backfire or it's just not really going to work. So using supplements, like you said, collagen, peptides, Dr. Best, we have Doctor's Best. If you're not watching this and you're listening, we have it right next to us. But also, like you said, L-Glutamine, and like really taking the time to delicately repair the gut so that it is nourished in the right way, let's just say, and not just like you're throwing random things and hoping that something's going to work eventually. So thank you for going through the steps.
We asked listeners to ask questions. So we're going to go a little bit more on like rapid fire, but they're kind of all over the place. First is, what mindset should people have when approaching their health?
Oh, that's a good one. Health, like we talked about earlier, could be very overwhelming at times, especially if you're not feeling good. Like, it's scary, it's daunting, especially if you've gone down paths that didn't work for you before. You could start losing faith in where you're kind of going as well. I would say the biggest thing I tell all my patients is we just need to make baby steps at times, like starting with a couple of the big areas that we know are going to start making you feel better, and then we could start compounding on top of that. So just kind of getting the ball rolling is going to be huge for someone, where if you're doing the right thing that your body truly needs to get this process started, just starting there, and don't feel like you need to do everything, because even myself, like, we got to have fun. We got to live. We can't just be scared of everything. Our bodies are pretty resilient as is anyways, that we just need to start by giving it the biggest things and start building off of that.
Yeah, I love that. Okay, next. How to support your gut without taking medication or spending a ton of money.
Cool. So I would just say food in general, because I mean, obviously we have to eat. So trying to get the biggest variety of foods and whole foods. I'm sure most people are thinking already whole foods, but making a good variety of this, because if we're also just eating the same food every single day, it promotes certain bacteria to start growing that work with those foods, that we need a variety. So making sure you're switching up your foods. Also, when people mention like eating the rainbow out there, I'm sure you've heard that, where we're getting different nutrients, and also they feed different bacteria within the gut. So huge variety is going to be the best to begin with there, as long as it is not reacting with your body.
Right.
What are your thoughts on creatine?
Creatine, definitely the rage these days, but really great stuff. Creatine, it's the first energy for our muscles. So you're helping rebuild muscles, give your muscles sustenance, but you're also, there's so much coming out for brain health as well, that it's helping with cognition, helping with maintaining our brain health. Really great supplement there.
I feel like creatine was always advertised as like a man supplement. So the question specifically was like creatine for women. Both parties can benefit, right?
For sure. Yeah, we're seeing it definitely diversify a lot more, which it never should have been this kind of bodybuilder fitness world type of supplement there, which it's been used for years in that area. However, we're seeing now kids starting to use it, the female population using it, because it's needed for everybody.
And you don't need to take a different type of creatine if you're a woman versus a man.
Nope. So creatine monohydrate is the most studied version out there. There's all of these really fancy blends out there now, but that's really the most studied and efficacious one on the market, and works wonders there.
We always love seeing brands that are like, we sell creatine for women. It's like, okay, tell me about that. Okay, next question is how to support your nervous system and how it ties into supporting your gut.
For sure. Yeah, this is huge. I'd say a lot of, especially when it comes to gut, I notice a huge connection with those two, which most people do when you look into it. Figuring out what their stressors are in terms of if it's their job or if it's their family life. And sometimes these are stressors that can't be removed. Like you're not going to break up a relationship all the time or not have your kids anymore, but figuring out coping mechanisms for them that work, that could help bring down stress when it's in certain circumstances there. But then also sometimes it even relates to trauma. I see this quite a bit too. Patients bring up that there was some type of traumatic event in their life that they fully haven't processed through as well, that they were just kind of shoving back in the background, that helping them work through ways to get through that as well. Very, very beneficial to relate to gut as well.
Everyone wants a supplement. Like, I feel like people feel good when they can take a few supplements every morning. It's a part of their routine. So I figure give the people what they want. We're going to give some general supplements that you love for different categories. And we'll make just the disclaimer now that this is for generally healthy people that aren't dealing with any specific chronic issues, because it always depends. It always depends. But we've made that disclaimer.
And what doctor's best supplements you would use for these?
Right. So we'll go with some different areas and just kind of share what you like and why you like them. And we've might already gone over it, but we'll get through it. So when talking about just overall improving your gut health, what are some of your favorite supplements for gut health?
Definitely the glutamine and fish oil. Those are any type of gut condition. Those are almost all, I prescribe them almost every time.
And explain glutamine to me with like very little science.
For sure. So glutamine is repairing the cells that are causing leaky gut to start connecting once again, to make that wall from the outside environment there.
I like that visual.
The fish oil, just to get rid of inflammation. So pretty much no matter what, we're decreasing inflammation, which is disease per se, and then re-strengthening the actual gut itself.
Okay. Now, what are your favorite supplements for skin health?
Doctor's Best does have a nail and hair complex. Uses an ingredient called Lustreva that does have clinical data behind helping support hair and skin health. That one, really great. Also collagen peptides. I mean, collagen peptides are 3 amino acids that also help give you the building blocks to repair skin as well. But outside that, I'd say hydration too. I mean, just water intake is huge.
Free.
So, yep, free. No one likes a free idea. Everyone wants there to be, they always complain that it's expensive, but then you give free options and they don't want those either. I'm like, what do you want? $20? Is that good? What about anti-aging?
Definitely the NMN CoQ10 one.
Yeah.
Getting back to that mitochondrial health. If our mitochondria aren't working and they start getting sluggish over time, it's one of the biggest foundations to aging.
I feel like Dad's going to jump on
Yeah,
M&M.
he totally is. He's going to be flying to California for methylene blue. Like,
Our dad loves like a good, like just all-purpose supplement. Like he puts black seed oil in his coffee, which is disgusting. Like I think it's so gross, but he's like, he loves like anything that's just like a good like bang for your buck. Yeah. I feel like that would be his. Okay, what supplements would you recommend to improve sleep?
So sleep is interesting because there's people that can't fall asleep and then there's people that wake up throughout the night there. Sometimes when it goes to falling asleep, we look at oftentimes like some of the herbs. L-theanine's a big one as well in terms of nutrients. Also, melatonin's a very well-known one out there. But then there's also the issue of people not staying asleep as well. Sometimes we see this related to actually like liver health as well, that we need to work on the liver. So detoxification supplements like your glutathiones, NAC, N-acetylcysteine could be beneficial there.
I feel like it's very hard as a naturopathic doctor for you to actually answer that with like supplement, because you're like, no, let's actually go deeper and figure out what's going on in the body to where you can't sleep.
Yeah, you
Sleep
did.
is a big, it's a wide range of what could happen there.
Yeah. Okay, what about supplements for recovery?
Recovery, definitely. So the creatine is great too. Creatine has that benefit there. Taking it post-workout helps give your muscles the reserves back that it just depleted. So your next exercise is kind of ready to go there. Glutamine also that we spoke about, besides helping that tissue of the gut, it helps repair the muscles after we make those fine kind of tears in them that are creating new, bigger muscles over time. Those are honestly two of the bigger ones there. And then your protein too, just making sure you get adequate protein intake after exercise.
Yeah, I feel like we've discussed a lot of different really high quality supplements, but are there any that are underhyped that you think deserve more attention that we haven't asked about?
Also making sure you're getting your basic nutrition, I guess, to begin with, because all of these supplements, they are just like what they're called, supplements. We shouldn't be just relying on these. Let's focus on, once again, the basics, get back there and give your body the support it needs. It's really so dependent on the person. I mean, every patient that I see, I mean, we kind of make this joke in our world too called green allopathy, where we're, instead of using drugs, we're just using supplements to replace them, which yes, they also have a time and place, but getting back to those basics is really important there too.
It's almost like you said, supplementing, like adding them to, you set your foundations and maybe you take a few things just for that added bonus. Like instead of making it your entire health protocol is supplements and then you go and do whatever you want with your diet, nervous system, etc. So I love that message because I think even though I feel like it's being said a lot, it's something that I don't think people do well enough because of the whole consumerism era that we're in right now. So
what are your thoughts on melatonin?
So I'm a huge fan of melatonin for a couple, it depends. I use it a lot with oncology patients. There's actually a lot of research behind helping different types of cancers within the body at different dosages than we'd use just for sleep support. When it comes to helping with sleep though, we also need to look at, this is where that neurotransmitter test comes back into play, because we need to look at, that also breaks down the amino acid building blocks, serotonin, then melatonin, to see if there's any dysregulation there that we could actually replenish our brain's own melatonin, as well as now with blue light and not getting proper light on our eyes, there's a lot of light changes too that I work with patients, like tell them first thing in the morning, go look at the sun, get rid of blue light, end of the night. So melatonin, I don't supplement as much as trying to help with their own natural melatonin production there.
Yeah.
I mean, I think you kind of might have said a little bit, like, do you think a lot of probiotics are overhyped?
Definitely, yeah, and because we need to make sure we're giving a patient the right probiotic. I'd say the other thing when it comes to overhyped is just looking at an ingredient that's listed on the front of a label too. Like we see this so much where okay, that is a good ingredient, but then if you really know proper dosaging behind different nutrients, you turn it around and you're like, okay, cool, you had this in there, but it's not going to actually do anything.
Yeah.
We know that. That is super common where people use these fad nutrients that are out there, which yes, can be very, very good, but they're not using them in the right way.
I saw a Dunkin' Donuts ad. It was for their new 0-gram sugar coffee. And then they say, with added vitamin B. And I was like, what are you talking about? First of all, no one's going to Dunkin' Donuts to get their vitamins. Also, I didn't look at the ingredients, but I would be very willing to bet that they don't have an adequate enough amount of vitamin B in their 0 sugar coffee to actually create any sort of benefit. Yeah. It's just like, so why? Like, what are we doing here? Like, and just go enjoy your Dunkin', right? Like, don't go get your vitamin B from there. What to kind of wrap up, if there's only 2 or 3 things people could do to improve their health without going to see a doctor, what would you say that they are?
I'd say 1, your nutrition. Nutrition, what you're putting into your body becomes you. So focusing on what you can do best there. Obviously, there's limitations out there. Sleep would be the next biggest one, is just trying to get adequate sleep if you can there. And then the last is just movement and detoxifying through movement as well. If that's going to the gym or just taking a walk daily or sauning even to get some of that blood flow movement, super important there.
Yeah, no, I love that. We finish every episode asking the guest what their favorite health hack is, like something you're doing in your own life just to improve your own health. What's your health hack?
I'd say I have a lot.
Yeah. Give us a few.
My favorite is contrast therapy. So I have cold plunge and sauna at my house that I use like 4 or 5 times a week.
Really? What's your timing for each?
Depends on how much time I have, but I try, if I can, do at least 30 minutes in the sauna, then the cold plunge for 1 to 5 minutes there.
Okay.
Yeah.
Love that. Any other ones you were dying to share?
That's my favorite.
Yeah.
For sure.
Okay.
That I bought a sauna first years ago, then added the cold plunge on, and it's something I know I can't live without.
Yeah. I love that.
I feel like I was doing it when there was such like a big hype over it a few years ago, and then I just stopped. And do you have thoughts about the difference between men and women with contrast therapy?
Definitely. So that is an interesting topic, actually.
Yeah.
Especially when it comes to the cold side of things there, that there are some genetic changes as well that and during certain times of your cycle might not be as beneficial to do, especially cold plunging there. So it does become bio-individual. See how you respond to it. See how well it's working for you. Definitely not one size.
Yeah, because I feel like there were times where I was doing it, and then I would go, everyone was like, "I feel so amazing after," and like energy's high, and like mine would tank, and I'd be like, "Why do I feel like shit?"
Yeah.
And it was probably because maybe I was doing it at the wrong time of my cycle.
And then some genetics too. Like there's some people with cold plunging where everyone talks about, oh, you're going to shred fat and all this too. But some people actually store more fat by going.
Because their body's going into like survival mode.
Exactly.
We'll put all of where to find you in the show notes. But are you Dr. Devin Stone on Instagram?
DStone008.
Oh, okay. We'll put your
AIM
right. I love it.
We will definitely.
We'll link all the doctor's best supplements too in the show notes if you guys want to get any of those as well. But thank you for coming on.
I feel like I learned so much in such a short period of time.